Hello, everyone, from the sunny London in England. I give you all a very warm welcome to this online seminar brought to you by BSMA, the British Spiritist Medical Association. My name is Fabrício Assunção. Our association exists to promote spiritual welfare based on the spiritual, philosophical, and scientific principle of Spiritism. We do this by hosting congress, webinars, and research that explore the interaction between human health and spirituality. We are very pleased to bring you today's event, which is the second in a monthly series of webinars that will be hosting with so many doctors and healthcare professionals over the coming months about the diverse topics in comprising spirituality, healthcare, and medicine. We are delighted that Dr. Sérgio Thyssen from Rio de Janeiro in Brazil will be giving today's talk on the topic of mental health disorders, a spiritual approach to treat patients using mediumship and magnetism. This event is being streamlined live on YouTube and Facebook by our channel. We invite you all to interact with us if you wish through the chat and send your message so we know where you are watching us and from and where and say hello if you wish to. Towards the conclusion of our event, we will be an opportunity for us to questions and answers with Dr. Sergio. Before we start the talk, let me give you a few words of introductions about Dr. Sergio. Dr. Sergio is studied at the University um, sorry, just at university, Dr. Sergio specialized in solid state physics, magnetism, and superconductivity. He is also a general practitioner and a cardiologist, and he was a professor at medicine at the Souza Marques School of Medicine in Rio de Janeiro. He coordinated university extension course for decades. Dr. Serge is also well known internationally as a speaker on Spiritism and a scholar of the boundary between medicine and spirituality. It is now my pleasure to hand over to Dr. Serge Thyssen for his talk, Mental Health Disorder, a Spiritual Approach to Treat Patients Using Mediumship and Magnetism. Over to you, Sergio.
Hello, everybody. Thank you, Fabricio. Uh, Thank you to you and to everybody engaged in this meeting. I would like to express to everyone about my happiness to have the opportunity to talk about this kind of frontier between medicine and spirituality. Um, this is a very interesting issue because we have a very interesting experience from many decades, but uh, our colleagues in medicine, they are doing the same around the world. And I suppose that we are dealing now with a very nice differentiation in terms of medicine, medical science, because these aspects we are studying with colleagues in many countries, many different countries in this world. I am very happy to stay with everybody here and to stay with many people in the next weeks dealing with this frontier in benefit of the human health of so many people that are suffering around the world. I would like to share with you. Let me, okay, just a minute. I think you can see this is the first slide. I will try to introduce about this frontier and then also to present to you some uh, cases, some real cases that we are carrying during so many time. We would like to present many other aspects because this is one science, you know? But I will do some kind of resume to our reflections about this. So I put here uh, mental health disorders. So we are entering in one specialty in medicine, psychiatry, mental health disorders, spiritual approach to treat patients uh, using mediumship and magnetism. So here, with this first slide, we can understand that spirituality, yes, but when we put together mediumship, uh, we are introducing spiritism in this um, method. And when we put magnetism, we need to observe first that we have the magnetism in terms of mineral magnetism. This is another science. This is a science that when we are physicists, we are studying this, the magnets, uh, the aurora borealis, uh, the lines of force of the complexity of the magnet of the Earth, this planet, the train of magnetic levitation in Japan, in China, for example. This is another magnetism. But here, this is the magnetism from Mesmer, Franz Anton Mesmer. And with Kardec, because Allan Kardec, he was uh, a very important magnetizer. But this is another aspect. Let me show you something that we will appreciate together. Uh, as we can see now, the epidemic of mental disorders by the World Health Organization. Nowadays, we have 1 billion of mentally ill people today. Before the pandemics, before 2019. So, probably we have more people sick because of spiritual, mental disabled. Uh, as on Earth, by the statistics, we have 8 billion people. We have, in terms of mental problems, 12.5% of the current incarnated population. This is a very serious situation, some kind of tragedy in terms of humankind. Let's go. Another aspect from the World Health Organization. 1 in 4 people will experience mental illness at some point of their lives. 25%. Nowadays, we have, before the pandemics, 1 suicide related, obviously, in terms of mental problems, one suicide every 40 seconds in the world. But now, after the pandemics, uh, 2023, we have one case of suicide in each 30 seconds, a growing statistic. And this is the one of the aspects of the problem of the mental condition in this humankind. I would like to remember to you, to everyone, that the earth, this is not one example of humanity, of world. This is a hospital in terms of the solar system, in terms of this galaxy, the Milky Way, where all of us we are living. So, in this first commentaries about the relationship between the science, spirituality, spiritism, and mediumship, and medicine and psychiatry, what kind of world is this? As you know, my friends, tests and expiations, tests and atonements by many different spirits, including some of them, many of them, doctors in the spiritual reality. This is a great hospital of souls or spirits or human people. In terms of medicine today, thousands of clinical illnesses, different diagnoses in medicine, including, obviously, different mental disorders. This is our situation here on Earth. Cancer, cardiovascular diseases, infectious diseases by virus, bacteria, fungus, and many other agents of diseases. Neurological diseases around the world, all of this diagnosis. For example, cancer. We have a very nice progress in medicine, in medical science, because of the papers, because of the research in oncology, modern oncology, cancer disease. But independently of this, we can see as a clinician a growing pattern of the statistics of including always more patients with different cancers around the world. So, in terms of neurological diseases, stroke, for example, epilepsies, meningitis, and many others. In terms of psychiatry, to do one remembering with you, my friends and colleagues, anxiety, depression, autism spectrum disorder, attention deficit, hyperactivity disorder, drug addiction, one human tragedy in those days, in all of the countries. Maybe London, Rio de Janeiro, New York, Buenos Aires, donde sea. We have a big number of people dying every day because of the drug addiction. For example, because of cocaine, heroin, because of fentanyl. This is another issue to a future seminar or webinar relating medical problems and spirituality, schizophrenia, panic syndrome, and many others. What kind of world is this? undiagnosed mental disorders. The people in medicine, they do not pay attention to this aspect. Many colleagues, but this is very common worldwide because we have in families, in society, in the commerce, and all of the human situations in this civilization. We have many people without the diagnosis of anxiety, of depression, and all of that important as lists of different diagnoses in psychiatry. And this is important because we have troubles, we have violence against the woman, the child, because of this mental disorders without the correct diagnosis, and because of without diagnosis, without the attempt to treat those undiagnosed problems. Another aspect to the future, this is from the recent years, moral illnesses. Moral illnesses. This is not from spiritism, neither from spirituality in terms of a big science. This is from medicine, especially in cardiology. The relationship between cardiovascular diseases and moral illnesses. This is a new chapter in modern medicine. Another aspect to the future in those webinars, religiosity, spirituality, RS in medicine. This is a light to the medicine. Billions of sick people in the spiritual world too. Because when we are dealing with those aspects now, we are forgetting the other side of life, the spiritual realm. So we have in the other side the same problem and the same kind of statistics, because we have 14 billions of discarnated people, and maybe a very important number of people statistically with moral problems, psychiatry problem, outside the hospitals and clinics, in the astral cities in the other side. With so many and important necessities in terms of diagnosis and rescue to the good spheres of life. So we need to understand that we have the medium umbral, the lower umbral, the darkness. This is the world where we are living. So we need to care the spirits in the other side of life, in the same mediumistic meetings that we developed in the spirit centers around the world. Another reflections with you. What kind of word is this? Obsession. No one gets sick alone. Or this is the idea that when we care by the mediumship, when we open a case of cancer, when we open a case of one neurologic problem, cardiovascular problem, severe infection problem, and is the same with a depressive woman, with a little girl with autism. We always find spirits. They are always doing some kind of participation of the process of the health problem of that woman or man, independently of the age. So this occult influence, we name in Spiritism obsession. I would like to remember with you in terms of Jesus and the lunatics. Everyone was obsessed. And you remember as spiritists in terms of the legions of obsessors in some cases. And here we can see Jesus helping us to understand the psychiatry problem and the benefits that we have when we care those patients with the tools of the spiritism. Transgressions of divine laws for millennia. And this is the heritage, this is the consequences from that. The mediumistic psychiatry of the future, and I suppose that we are doing this practice from decades till now and from now to the future. We will tell to you some aspects of the unavailable contribution of spiritism to psychiatry. This is amazing issue in terms of this approach. How to prevent mental illnesses. This is a challenge to the humanity. And we need to understand the moral, the spiritual aspect linked to the mental disables and illnesses. Spirit science in the best psychiatry conference in the world. We name this intersciences because medicine, psychiatry, psychotherapy, psychology, psychoanalysis, and spirit science. And we remember you when we talk about spirit science, we are remember mediumship and all of the beautiful aspect of the science. The epidemic of mental disorders. We need to remember again, why all of this suffering now in all of the world. We have 2,000, I will remember for you. But the accentuation of the consequences of the humanity's spiritual imperfections. This is the main cause of the mental problems around the world. Because we are the same spirits, the same souls. We live in many old reincarnations. And we are dealing with the consequences of our imperfections from the centuries and millennia ago. So let's go to remember the predominance of materialism. Disease comes from this paradigm, materialism, and we need to change this. And spiritism is the best, I understand, the best way to a big change in those aspects of humankind. We need to consider to us the devastating triad, the pride, the selfishness, and vanity. We need to change to the virtues that we need to develop inside of us. This is preventive medicine, including all of the different diagnoses in medicine. We need to consider as spiritists, as we are together now doing this study in this webinar, we are in one point of planetary transition. And when we go to the Genesis from Allan Kardec, or when we study the Revue Spirit, Spirit Review, in 1866, we have messages from the good spirits telling to us that the biggest mark of the planetary transition is the madness. Review, spirit. So, including the suicide, this is Kardec telling to us, spiritists, from those decades in the middle of the 19th century to now. So all of these aspects, they have one kind of relationship to our understanding of our situation. Here we have from one very nice review in medicine from the best magazine in medicine in England, The Lancet. We have one idea when we look to all of the regions on Earth. In all of them, we have depression in blue, we have anxiety in red, and all of different diagnoses, schizophrenia, bipolar disease, eating disorders, childhood behavioral disorders, and many others. Because this is spread to all of the world. So independently of the country, of the region, the problem is the same. We saw variations because of the statistics. This is another aspect. ASD, autism spectrum disorders, for example, in USA, when we present to you from the CDC in Atlanta, Georgia, doing one statistic in all of the United States of America, we have the prevalence of autism, and we can see the growing curve showing to us the big problem that we have, and we need to know about autism. We need to know how to care our children included in this spectrum disorder. This is very impressive. For example, where will we stay in more 10 years? This is a challenge in medicine and especially in modern psychiatry. Here, we have a mountain of cases in depression, the higher one, anxiety in red. So, independently of the age of the human beings, of the incarnated people, we have from the childhood to the higher ages of the people with near the adult life. Here, the difference between male and female No difference. We have female just a little higher in the statistic, but we can see one equilibrium in the number of cases. Why? Because all of us, we are spirits, independently of gender. And all of us, we can present one mental disorder in one uh, time during our reincarnations, our lives now. The Lancet, can you see? Welcome, Sergio Thyssen. During my research, another important aspect, no health without mental health. So we have consequences to all of the society, but including consequences in terms of the problems in other situations, including cardiovascular infections, diabetes, hypertension, and different diagnoses, because the people with mental problem, they have difficulties to care of themselves in terms of the many others problems in their health that they need to care. Do you understand? Here we can see one statistics that we have in blue, neuropsychiatry disorders is the higher in terms of different, for example, the other blue, cardiovascular disease, respiratory disease, digestive disorder, and many other. So we have the different diagnoses in psychiatry here. So pharmacological approach in conventional psychiatry, targeting only the brain neurochemistry because of the neurotransmitters. This is one materialistic paradigm of psychiatry. Unsatisfactory results in treatment. Treating effects, treating symptoms, and this explain the poor results. So we need a paradigm shift, spiritual paradigm, spiritists, not only spiritual in general, but spiritists. We are remembering in terms of primitive words of tests and expiation. This is our case on earth. Words of regeneration, happy words, pure words. So we have a big process to the future. And we need to understand why so many suffering people in different diagnoses in medicine, including different problems in psychiatry. Now, when we pay attention in terms of spiritist approach for patients, we have two main techniques to care. And we need to care case by case in these meetings. We need to personalize, individualize the approach to benefit each one independently from which country, the age, independently of every aspect. Disobsession or the treatment of the spirits related to the cases, each one case in different moments of each one of the meetings, mediumistic meetings, and the fluid therapy or the magnetic passes, as it is common to refer in terms of this practice. From Mesmer to the magnetizers, the contemporary of Kardec, and in those days. Uh, you can see here one paper in a different magazine in medicine, the effect of spiritist pass energy therapy in reducing anxiety in volunteers, randomized controlled trials. So we are spirits. Maybe we are doctors. Maybe we are working in this field of trying to benefit the suffering people. But we need to recognize new times, progress times, transitional to the felicity in terms of good results to our patients around the world, and utilizing medical science to spread this knowledge about how to care the people. I would like to remember with you, this is a photograph from my machine. I, I, I remember maybe from my cell phone, but uh, this is the first Congress that I visit uh, because the suggestion of a psychiatry, my friend from Argentina, y entonces he visit our group and refer to the mediumship meeting one very severe case of a patient of Dr. Sabino Luna. Y entonces, knowing this approach, he becomes very surprised and optimist, and tell to me, Sergio, please, you need to share the experience of your group with my colleagues in psychiatry. And he tried to link one first possibility. And the first one in 2008, October, in Beijing, China. So I share that experience in those years with colleagues from around the world in China for the first time. But after this one, I visit many different congress of psychiatry, the World Psychiatry Congress around the world, sharing with the same idea. This is the first slide in Beijing. Spiritual approach of mental diseases from the National Institute of Health here, the Allan Kardec Spirit Society, Beijing, 2008. The first slide or the presentation. So I would like to remember with you fundamental postulates from Spiritism: immortality of the soul, survival of the soul after that, reincarnation, law of cause and effect, action and reaction, communicability of the spirits, mediumship, intervention of the spirits in the physical world, existence of the spiritual world, physical body, spiritual body or perispirit, and soul or spirit. I share this with many and many psychiatry around the world because they know nothing about spiritist fundamental postulates. So the soul accumulates its experiences of all previous incarnations, illnesses of the body and mind in consequence of the torments of the soul, existence of the spiritual world of sources, the world of sources, causal, matrix, place of life of the spirit, interchange between the two worlds, reciprocal action among beings of the two worlds. This is a science. Law of personal responsibility, cause and effect, action and reaction. Mediumship, the main aspect of this approach, in the centers of spiritual treatment, allows to see the spiritual body or perispirit from clairvoyance, allows comparison between this body and the clinical situation of the patients, allows to see the results of the spiritual treatment, allows to see the spirits, to talk to them, to treat them, and to detach them from the case, allows to see the situations of other lives that are related to each case in terms of very important symptoms of psychiatry manifestations. Center of spiritual treatment, incarnate and discarnate them. This is very important aspect. We are incarnated in the spirit society around, for example, a table, but it is the main aspect of the meeting, the spiritual environment, not physically, but what kind of spirits are in the caring of our individual patients around the world. Today, in this Saturday, when I begin to stay with you, I finish a mediumistic meeting, and we care of patients from different cities around the world. This is common. This is regular. This is simple. So, incarnate and discarnate them. Bezerra de Menezes, Eurípides Barçanufo. Today, this morning, Felipe Pinel, the father of the modern psychiatry, Joana de Ângeles, and others. Volunteers work free of charge of all of the participants, obviously. Ethical aspects of the mediums, correct personal life, fraternal and charitable attitude, cultivation of virtues, trying to do it day by day, responsibility and compromise with the spirituality that is in charge, and other caution with diet, avoid alcoholic consumption, smoking, and any other kind of excess or the lack of rules in the personal life. Centers of spiritual treatment, how are the mediumship sessions? 6 to 12, for example, mediums around the table, individualized service without the presence of the patients. Name, age, and address. This is what we need to care. Sites, incorporations of the spirits connected to the case. We can see them independently of the space-time curve. This is another issue, because frequently when we open the case, we stay in the past to care what remain in the past, in the big necessity to help people and many people together frequently for each one of our cases that we would like to love and to care. Rescue, treatment of spirits, and reference for further treatment frequently. This is one idea to the people that do not have experience. We have a table, we have incarnated people, discarnated people in good and in bad situations. So I would like to present to you maybe 4 cases to some kind of exemplification. But we have thousands of cases because, my friend, I stay studying mediumship and working in this environment during the last 45 years. So people send to us, to this spiritist group, where many physicians and nurses work with us, including all kind of people and mediums in terms of psychophony, in terms of clairvoyance, in terms of magnetic healing. Let's show you some idea. This is one case from Rome, because one Brazilian woman married with an Italian, they did a contact. I don't remember. I remember maybe by WhatsApp some years ago, telling me about her son, Raffaele, autistic in a very important grade. In autism, we have levels 1, 2, or 3. This is a case of 2.5, more or less. So, from home, Italy, many different treatments without success, troubled relationships of the parents, moving to a divorce. The mother reached me after watch a talk online and writing to me, I have been experiencing suicide thoughts. Please help me. Today, my thought is either me or him. This is incredible, incredible. I ask to the mother to send to me by WhatsApp some videos because I need to know something important about each one of the patients, especially in terms of children. Let's go. Frequently with aggressive attitudes. Rafa and his father talking in Italian, obviously.
Stai in silenzio, fai il bravo, ti non porti bene, ok? Va Va bene? Metti qui seduto, ti comporti bene e aspetti in silenzio.
During one in the automobile, in the car, crisis, crisis, crisis. So we opened the case of Rafa in one mediumistic meeting. Immediately when we opened, we could see one kind of war. War is very frequently because our cases frequently they are very intensive in terms of severity of cases, independently of anxiety, depression, schizophrenia, drug dependence. So when we open the case, we are prepared to care in the past lives of the consequences of each one of the patients did in this they choosing during their lives and frequently causing harm and prejudice to not only one people, frequently in a very big context that are now in the spiritual environment, related, linked magnetically, linked with the patient, with the mental, soul, spirit condition of the patient, incarnated now. More or less 1 month after this first approach to help Rafa, I receive in my WhatsApp, today we are celebrating 2 weeks without any crisis. My gratitude to Dr. Sergio. Passing more weeks, I receive again. We have passed more 4 weeks without any crisis by Rafa. So this is one emblematic case. So I asked to the mother, I am understanding the benefit and the symptoms that disappeared in terms of so frequently crisis. And so I asked to the mother, please do and send to me one video of your son without the crisis. And I received this one.
Raffo, un parco molto bello. Dimmi un po', di a mamma, com'è questo parco? Guarda mamma qui. Ti piace? Vado un bacio?
Piace bacio.
Dici che mi ami?
Diga que me, tell that you love me. His sister. This is Fabiana, Rafa's mother. She sent to me this one. I would like to share with you, this is Fabiana, because I visit many times Italy, only to share with the people from different cities and groups, spiritist groups, about this kind of approach. And I was invited to Padova to do a conference about spirituality, spiritism, and medicine. And she comes from Rome to Padova to stay with me. And we will stay some hours together. And here we can see the relationship between this photograph and here the idea in this drawing, the happiness of the mother.
Vai,
Isso, dava.
e manda-lhe um bajeito, não?
This is a kiss to Dr. Sergio because the suggestion of Fabiana. Another case, autism, grade 3. Independently of the willing, this is a patient from Rio de Janeiro that comes to my office, medical office, with the mother and the father. And I received this case, took care as a doctor. And immediately when I stay with them, father, mother, and the patient, I suggest that they bring the son to the Spirit Society to care with the Spiritist approach. And then we open the case, a very important conflict with many victims, and we care of all of them in a sphere of life, in one time of the history of this spirit, that in this reincarnation, his name is Lucas. Some weeks after, amelioration, not cure, benefits, visible benefits, here with the grandmother, here with the mother. Another case, William, 6-year-old, in Salvador, Bahia. In the presence of mother and father. All of those children very carried with love, with empathy, with compassion. Suffering. Mouth and ears. When we open the case, we find many spirits in the inferior umbral and darkness. Frequently victims, but colleagues from very bad attitudes that they done together. So we need to look for all of the spirits linked to each one case, because we need to be that group that will care of the other one. Because when we open a case of one incarnate suffering people, suffering child or adult, we are doing one medicine that goes to the spiritual reality, and we invite, we receive in the field of charity and love and light, all of the spirits that are suffering because they are sick too in the other side of life. Here, I remember till now, one Thursday, I was guiding to come back to my house from the Spirit Society in Copacabana. I received one cell phone, one call from the mother. Sergio, Dr. Sergio, what happens? Why you tell me this one? Because he is completely different. Oh, let's thank to Jesus and to God. Here, I ask another video to a documentation of the changing. Peace.
Dá um tchau pra mamãe. Gil, dá um tchau pra mamãe. Assim, vá. Agora, dá um tchau.
The first smile. And then he is receiving medical treatment during those years from this occasion from now. But it is completely different. For example, the mother.
Tô gravando para desejar uma boa noite, né, Gui? Dá um tchau para o Dr. Sérgio, Gui, tá? Aê!
Do you understand, Fabiana? Do you understand the smiles of the family? Another case, this is a different case. Leticia, 22 years old, law student in the university in Rio, started feeling severe daily headaches in the past 5 months. The first manifestation, the first symptoms, headache. All exams, including neuroimage, were negative. Migraines, arteritis, tumors was excluded. She became depressed after 2 months of headache, left the college, spent all day long at home, mostly in bed, with the doors and windows shut. She took some antidepressives because this is one moderate or severe depression case, in vain. Antidepressive drugs. Her parents took her to different psychiatrists who prescribed different medications with no success. A neighbor suggested taking her to a spirit society. This obsession revealed, she was being tortured, mostly in her head, by a group of spirits when her soul left her body at night when she is asleep. In a previous lifetime, she had been a Nazi officer in Auschwitz-Birkenau, near Krakow, Poland. In that time, but Leticia now, treated the prisoners with extreme violence, indifference, and cruelty, and had personally tortured several of them, some to death. Some of them had not forgiven her and started chasing for revenge. They were worldly Jews, Russians, and gypsies. And we can see them and care of all of them, independently of the number of victims, because we do not invite each one to a psychophonic manifestation. We receive one or two to a direct benefit to them. But we utilize the physics, geometry, and electromagnetism to create by ideoplasty a very extensive context of help, of rescue, of love and benefit. And the results, they are very clear because we stay in the meeting monitoring the results. And we only finish that approach when the last one spirit in better condition are benefited and guided to the hospital and many different hospitals that are related to this kind of work. One spirit led the group and was taken to the disobsession meeting. He spoke with me through a medium and expressed all his hatred and anger. He was shown the reasons behind so much suffering in his last existence on earth as a war prisoner, before the Second World War in Europe. He was urged to quit his revenge purpose and was led to a bright future of recovery and happiness in a spiritual settlement where he would resume his evolutionary process. He was decided to take many of their colleagues in this way to go out to the same high sphere environment, waiting for everyone. This is one approach in the spiritist meetings in terms of mediumship that we can utilize now. The other spirits, almost 200, were fluidically and magnetically disconnected and convinced by the leader to leave the patients. Frequently, we invite the leadership, because when we have the good result, all of the other comes with us and is guided to the heaven, one kind of heaven. Leticia received magnetized healing and water for 4 weeks. Her health kept improving and her symptoms were gone so fast that the family and neighbors were awed at such a miracle. And 3 months later, she stopped going to the psychiatry and resumed college and normal life. One case more, and we will finish. Deborah, 44 years old, Brazilian, married, and mother of 2 children, director of a multinational company, started to present symptoms of depression 6 months prior. Insomnia and suicidal ideas during last month. Relevant weight gain in this period, obesity. Treatment with antidepressive drugs with the right doses but without significant improvement. The husband bring his spouse to the fraternal carrying in the spirit society. This obsession, the mediums observed two spirits in the fetal form, small, located in the abdomen area near the solar vortice, solar chakra, presenting serious and bleeding wounds because abortion, induced abortions, and they were unconscious. Another spirit communicated through the medium by psychophony and appeared very aggressive, having hatred against the patients, willing revenge too, because she felt like murdered by her because of the abortion, due to a provoked abortion. And he was this spirit that induced the suicidal ideas to Deborah. And the three dead and the spirits in the spiritual reality, some kind of non-intentional weight in the mental situation of the Deborah mind. Fraternal dialogue with ideas of forgiveness passes for her emotional and physical perispiritual recovery. In 1 minute, forecast of a happy future and a rebirth. The spirit was referred to a hospital, in a spiritual colony, in a superior spiritual realm to continue her treatment. The two others were detached from the body of the patients, the perispiritual, the astral body, receive fluidic treatment with the team's resources, with immediate improvement and healing. And then they was still unconscious, guided to the hospital, to the improvement in different approach in the heaven, in some kind of heaven. Deborah presented progressive improvement of her symptoms, and in 3 weeks, she came back to her normal life. Her psychiatry diminished the dosage of the medication and suspended it in 2 months. The symptoms of depression never come back. She is cured. Diagnosis advanced depression because of 3 provoked abortions in the present life. Deborah, she was invited to work with us, and she, from that occasion, deal with children in the school of gospel to the children in this community. To finish, I would like to remember that this approach, we are so happy. I am trying to share these results, this kind of benefits with our colleagues. Here, before the pandemic in Lisbon, 6,000 of colleagues in the big area of the mental health. Psychiatrists, psychologists, psychanalysts, psychoanalysts, and psychotherapeutics. 6,000. They look at me, they have some need to adaptation, because I talk about Allan Kardec, about Francisco Cândido Xavier, mediumship, spiritual reality, cause and effect, influence of the discarnated people. All of this, the main postulates of the Spiritism, they don't know nothing about this. As in Beijing, China, 2008. Here, 2019. This is the poster in Lisbon, influence of discarnate people in mental disease and its respective approach. Our spiritists and doctors from our Spirit Society. And the people comes to discuss about what kind of this in psychiatry. And this is the results to share with them. In the Congress of Lisbon, I was invited to the next Congress from the World Psychiatry Association. But with one group of specialists in the world interested in international congress of spirituality in psychiatry, in spirituality in psychiatry, in this frontier. This is a construction of the modern science in medicine and spiritism. This is history. So I present in Israel, in Jerusalem, in December 2019. This is the first slide. For example, I sent 2 papers. This is one. The influence of the spiritism in autism spectrum disorders patients and the benefits of the psychotherapeutic approach, fraternal dialogue, gospel, Jesus, good spirits, charity, fraternity, reencontro, Spirit Society. Another invitation, 12 December, in the United Nations headquarters in New York, invited by them, depression and suicide, but a medicine and spiritualist view. And this is one new possibility to deal with the seeds of light from spiritism. To finish, Madness and Obsession. This is one painting from Vincent van Gogh. Very impressive. Mental illness is a disease of the spirit, and in the spirit it must be treated. Joanna. And different other aspect. The only one to understand or to reflections in terms of prevention, inner transformation and education of the feelings, cultivation of the virtues of the soul, altruism, peace, solidarity, fraternity, disinterested charity, capability to forgive, internal work in general, but voluntary work, but internal work to change ourselves. Prayer and ties to the superior spiritual life by the mechanism of the prayer. Spiritualization of all aspects of life, purpose of life, with the spiritist postulates in terms of what kind of world, what we are doing here, where we come from, knowledge and compliance with the divine law. science and faith, medicine and spirituality. To be born, to die, to be reborn yet again, and constantly progress. This is the law. Allan Kardec, thank you, my friends, for your attention.
Thank you, Dr. Sergio. That was. Can you hear me okay?
Yeah?
Yeah. That was a very refreshing presentation for us. And I was listening to the presentation. I was actually thinking myself, um, what a relevant topic for us to be discussing here. The statistic itself say 1 in 4 people will suffer somehow some mental disorder, and that is how important for us to be talking about mental health. And it's interesting when you presenting um, the practice of mediumship in spiritual centers in Brazil, and I can share an experience that I had last week here in England, where we invited a speaker to come and talk about mediumship and how mediumship is used to help the spirit, mainly on the disobsession front of work. And we um, had this workshop, and we were presenting this mainly to English speakers into a spiritualist church in England. And they, for the first time, they were giving me a feedback that it was very interesting to see the way the spiritual centers in Brazil and some of them here in the UK and other countries are using mediumship to treat patients. And they never actually realized, or they were not aware, that some of the work they would do in spirit center is actually to rescue the spirit that is suffering some influence from other spirits. And I think what I would like to ask you, because it was very new for a lot of the audience that we were presenting, that what we call the rescue work. I would like you, if you could, please, elaborate a little bit more on the approach, how the spirit centers are using mediumship to help those obsessor spirits to maybe go to a different realm and receive some help and maybe change their mind of the obsessed idea of harm the others.
Fabrício and colleagues and friends, uh, in Brazil, it is very common in different states or cities, uh, the mediumship meetings in different stage of practice and experience. But we need to understand that because of the condition in moral terms of this planet, this humanity, if we are spiritists, if we know something more about our big family, the humanity, we need to do the best to care of the spirits independently that we know or not about the relationship of them in terms of patience. So every spiritual manifestation, when we understand the problem of that spirit, and they are in all of the mediumship meetings, because this is the main project of the good spirits, utilizing the mediums to receive patients, to receive spirits with moral problems. So all of the mediumistic meetings in the level of training mediumship, they are important because what kind of training we need to do? Love, fraternity, to help, because we, including we spiritists around the world and in Brazil, we don't know clearly the suffering that we have in the spiritual world. The how many people in the pardon, in the inferior umbral, in the darkness and in the abyss, with big necessities from this kind of love, the love of the environment of the spirit society. Because this love comes from the incarnated team, but more important, the discarnated ones. So this is the mission, the true mission, to care, to receive, open the doors, open the hearts, open the minds, because all of them spirits, they are brothers and sisters in the same family with Jesus from Nazareth. So another aspect to comment, we need to work in some capacitation when teaching to more groups could have this science, this one kind of science, one spiritist science with the gospel, with the virtues of fraternity, compassion, and empathy, to the big contest of one humanity that stay so far from the good spirits of life and happiness. So, for example, frequently I try to visit with mediums from here, with this experience, and to show how to deal with some cases with more suffering, complexity in the spiritual environment. But we can do it in London, in England, in this year maybe, because I suppose that this could help the groups to some kind of growing condition to do the best, the better one to so many people in Europe, including, because we understand that all the spiritual realm are the same. No, because the same division, unfortunately, that we have here, we have in some spheres in the spiritual world. In the highest one, no, but more near the common life in the material world, we had some division. So the visiting is interesting because of this too. Because Ukraine, because the First, the Second World War, we, including now from here, Brazil, trying to care of people reincarnated here, frequently we see problems in Europe, Asia, North America, and all of the world.
Thank you. Thank you, Dr. Serge. So what I would like to do now, I'm aware of the time, so maybe we can do another 10, 15 minutes of questions and answers. And there are loads of comments here on the chat. So we have one here from Flavia Kolb say, thank you, Dr. Sergio, for the very informative talk on this very important matter. This is mental health and the influence of the spiritual world.
Thank you,
Um,
Flavia. Thank you so much.
And then we had another comment here from Giovanna. She say, could you share the published papers, the role spiritism in the autism spectrum?
Yeah, I can give you my WhatsApp by uh, Fabricio, and I can share with you uh, these studies.
Okay. Another question come to us here is from Leandro. He say, as a healthcare professional in the UK, how can we help patients using this knowledge, but without impose on them a sense of religion, as many are opposed to their approach, despite the benefits?
Well, Leandro, um, we we have two main uh, structure to help: the mediumship meetings and the passes by the magnetism to change in the intimate aspects of the physical body, the brain, but the mind in terms of perispirit and soul. Um, the mediumship meetings, we can help without the participation of the patients and of the family members. What we need, uh, the search for this help by everyone, maybe a friend, maybe a family member, maybe a colleague in the health environment that knows about the suffering of the patient, independently of the patient itself. This is one idea that we can love and we can help independently of the idea that he or she is being helped during the meeting. But I understand that we need to talk about this because the lack of the notion about everything in terms of spirituality, we need to do something to this changing. This is one kind of light, and we need to visit and to talk about, share in one idea of spreading of this kind of knowledge. Why I am visiting the International and World Congress of Psychiatry? Because the idea to share. This is a treasury in my hands, in the hands of this group. And I need to talk about with them. This is a progressive idea to benefit more and more people. But in one day, uh, if you understand, if you, for example, I enter the internet and I go to the National Institute of Health, United States of America, by computer, notebook, or maybe cell phone, and I enter the PubMed. This is the site, the best in the world of research in medicine from every country, independently of religion, position, which country, uh, religions and other philosophical and ethnic aspects. If I put the word prayer, prayer in a side of medicine exclusively, I have 70 thousands of papers to read, to study. Do you understand? If I put, for example, spirituality and health, 25,000 of papers. If I put, for example, past lives, I have hundreds to study. So what it means? That this is a different time because Jesus is with us. All the good spirits working during centuries and millennia to help us to understand our problems in terms of health, too, not only, but too. So we need to share. We are here in this Saturday trying to stay together with friends to study those issues. So we do not need to have the acceptance of everyone because this is a materialistic word till now. But including talking about medicine, medical problems, suffering because of them, spirituality, spiritism, Jesus, Allan Kardec, mediumship, this is light to the world. So we need to do the best that we can in helping to a change of minds. Because in the future, as we have in Brazil, in a few groups, we can visit the patients in the bed where they are with different medical problems and to invite them and the family together to a prayer, to a hands imposition, to the passes, to the magnetic help from the mediums working and by the good spirits together. One day we can do it in England. Why not? Will
Thanks,
be a
Dr. Serge.
dream. Will be a very important experience, human experience. Do you can imagine the good spirits knowing about the spreading of this light from them to help the people that are suffering? Thank you, Leandro, for your question. Thank you so much.
So, Dr. Serge, your answer actually linked really well with the next question here from Natalie Tolbert. Her question goes as, how would you engage with psychiatrists and psychologists in the UK to raise awareness with them?
Very, very fine. Natalie, 10 years ago, I visited London. It was not the first time, but the bus combined one little congress, and I was invited to talk about spirituality. And I think after the pandemics that we could combine one meeting, inviting our colleagues, because they were in Mexico, in Bangkok, Thailand, in Beijing, China, in Lisbon, in Jerusalem, and I was with there. So the seeds of this approach, they are in the books, pardon, the books of the Congress. We have the abstracts included in the books, each one of the Congress in the last years where I visit. So if we can, all of us together, with the spiritist groups, we can plan one seminar inviting the colleagues in medicine, psychology, psychiatry to talk about, because this is a medical field of knowledge, of science. So this is one idea to us. Maybe in this year or in the next year, we can plan in the first meeting, maybe a few colleagues, because those few colleagues, they will spread themselves to other colleagues. What kind of approach is that? Colleagues from Brazil, from other countries, colleagues of mine in this area, we can uh, deal with them. And more than this, we can do practical meetings, will be not theory. Do you understand? Bring to us one case of your hospital that you are worried about, and we will open with the proper uh, authorization of the patient, the family, and the doctor. Let's go to think about this. This is the time. So, thank you, because your question, this is one dream, this is one idea to the future. Let's go to do it together.
Thank you, Dr. Serge. I just want to make a comment here on the last question, and I would actually like to say that on behalf of BSMA. So the question is from Adeline, and she say, should health professionals in the UK who are interested in this approach be put in touch with existing spiritist groups in the UK by some kind of organized network? So what I would like to say on that is that is exactly the BSMA objective. The BSMA are working on to build the bridge between spirituality and medicine. And yes, if those
Yeah.
professionals would like to get in contact with us, with Spiritus Center, that's exactly the work that we are trying to achieve. Would like to say something else, Dr. Sergio?
Yes, Adelina, she's Portuguese, but she is living in London. She's my friend. She participate of many different online of our study groups in spiritism. And I understand that it is the same. We can share those issues, linking medicine and spirituality in London too, and in many other cities in United Kingdom. Uh, Planning this from this Saturday to when possible, and I will be very happy to stay with you, including in the program, trying to help what is the the proper issues to share? How invite? What kind of doctors? Means of invitation, and we can do meetings online to the program, and all of us we can help to construct this first meeting from the British Spiritist Medical Association.
Thank you.
Naturally, right? Let's go to dream together.
Absolutely. Um, Before I go to the closing remarks, I have got some announcements that I would like to do. First, there is a questionnaire form, like a feedback form. If you could kindly answer those feedbacks, because that will help us, to assist us to actually improve our webinars and do more work in a format that the public wants us to do. So any feedback is very much appreciated. Um, and what I now need to do, so Dr. said, before I invited our friend Silvia to do the closing prayer, is there any closing remarks that we would like to do before we close our meeting?
I didn't hear. Please,
Um,
Fabrice.
I was saying, before we invite Sylvia to do the closing prayer, is there any closing remarks you'd like to do before we can close the meeting?
Well, first of all, I am very happy to stay during this hour and minutes with all of you. Unfortunately, I couldn't see everyone, but we will stay together in the future. And I am very, very satisfied for this opportunity. Maybe the first one, and we will stay with a family too, friends that love medicine, to know about the big problems of this humanity, and try to cooperate with the good spirits to see the people more happy and in spiritual freedom to their lives from now to the future. Thank you so much to everyone. And I invite Sylvia to stay now here. Fabrizio, if you permit.
Yes, sure. Thank Dr. Serge. Hi, Sylvia, over to you.
Hello. Hi, Sérgio. How are you? Long
Fine.
time no see. Okay, thank you very much for this wonderful work today. So we're going to close with a prayer. Beloved Jesus, divine friend, we thank you for this opportunity of being together with everyone who was here with us during this meeting, and the legions of spirit, of benefactors that were present with us during this instructive time. And it brings to us a lot of thought in how we ourselves need to start work, continue work, and begin new work to try to help the legions of brothers and sisters that are still lost in both sides of life. We thank this opportunity to thank the spiritual benefactors for bringing to us the consola promised by Jesus that would bring peace and understanding to humanity. And even though there is a lot of confusion and hatred in our world, we know that the path has been opened for the light for the future. We thank everyone who participated, most especially Dr. Sergio, for bringing to us so much of the work he has already done, and most importantly, his desire to help us in our work. We thank him and all the members of his group that works with him, his wonderful work that he does, and most especially spreading around this work around the world. Those are days of great need, and we need many, many workers. So we thank you for all the opportunities. We ask the blessings, sweet Jesus, to all our benefactors, our guardian angels that help us in our daily lives, in our lives, and in our working lives. Thank you. And as we conclude this work of today, we ask your blessings to each and every one of us, of peace, of light, and determination to fulfill our own work and our own missions. Thank you, Lord. May your blessings be with us today and forevermore. Amen.
Thank you, Sylvia. So just before then I can say goodbye to everyone, I just want to announce our next talk. It will be on the 10th of February. The topic is spirituality and psychiatry in the UK with Dr. Andrew Powey. So I look forward to see you all on the 10th of February. So thank you very much for participating with us, and I see you soon. Thank you and goodbye.
Hello, friends of medicine and spirituality. This is Dan Assisi, taking a second of your time to share my enthusiasm about the upcoming event organized by the British Spiritist Medical Association. It's not often that we have a chance to gather with like-minded individuals who believe that there is incredible value in bridging medicine and spirituality so that they may tackle great topics that afflict all of us in our everyday lives. So I am thrilled that we will have a chance to get together soon, and I hope that you will accept this invitation to join the British Spiritist Medical Association in such an important event. I hope to see you there.